Moving to the next question, which of the following foramen it is located in the anterior cranial fossa? So your answer of choice answer is foramen cecum. So this one is the foramen cecum. It's located in the anterior cranial fossa. So remember the foramens that are located in cranial fossa, they are the foramen cecum, foramen of cribriform plate, and anterior ethmoid foramen. So think of your brain as a house, and anterior cranial fossa it is the top floor. The top floor where your brain will sit. Now imagine there are small windows or opening in the floor of that top floor. So these openings are just like these are the foramens. So these foramens will allow the important things like the nerves and the blood vessel to pass from the brain into the face. So just a sort like how the windows they let in light and air into a room. So the foramen that is located in anterior cranial fossa, it's the foramen cecum. Moving to the another question, a patient who is not able to rotate his head. When he tries to rotate his head, the chin that will deviate to other side. So the muscle that is affected in this case is it's the sternocleidomastoid muscle. The sternocleidomastoid muscle, it helps to turn your head in opposite direction. So if it is not working properly, your chin may point to the other side when you turn your head. So when you turn your head, the chin will move to the opposite side. So this condition it is known as torticollis, or condition is known as wry neck. So imagine your sternocleidomastoid muscle. So imagine this muscle as a rope that goes from ear to your collarbone. So when this rope it is working properly, it helps you to turn your head easily, like looking both ways before crossing the street. But if this rope it get twisted or it does not work right, it will try to turn your head with a knot in the rope. So that is why your head won't turn smoothly and your chin might up pointing in a wrong direction. That is what we called it as torticollis or the wry neck. So if your left sternocleidomastoid it is shorter or tighter than the right one, it may cause head to tilt and rotate involuntarily to one side. So that make it difficult for person to hold their head in normal straight position. So that can lead to discomfort, pain, and limited mobility of the neck. So when the sternocleidomastoid muscle it will not function properly due to condition like the torticollis, that can results in abnormal head position affecting the person ability to move their head and neck comfortably. So answer is sternocleidomastoid muscle here. Moving to the next question, which muscle play a role in winking? The answer is orbicularis oculi. So the orbicularis oculi, it is the key muscle that is responsible for winking. It has a palpebral part that closes the eyelid, as in blinking or winking, and it has a orbital part that helps you to close your eyes tightly. The other muscles like the corrugator supercilii, so this one is the corrugator supercilii muscle, so that is responsible for drawing eyebrows together, and wrinkling of the forehead, that is associated with the facial expression, that is frowning. So main function of corrugator supercilii muscle is the frowning. That means when the muscle it contracts, it causes the inner end of eyebrow to move downward and medially. That gives a wrinkled appearance on the forehead. Other muscle like levator palpebrae. So this muscle is the levator palpebrae muscle. It is responsible for raising the upper eyelid. So it raises the eyelid, the upper eyelid. It helps to open the eye and keep it open, and it causes elevation of the upper eyelid. So when this muscle it contracts, it causes the upper eyelid to move upward, exposing the eye cornea and allowing for vision. This action it is essential for maintaining a clear line of sight. Other options like the muscles is levator labii superioris. So this muscle is the levator labii superioris. It helps to elevate the upper lip. So it helps to elevate the upper lip, and it is not primarily associated with winking. So mark your answer as B. Moving to the next question, the Stenson duct drains. Well, remember that the Stenson duct, it is the duct of parotid gland. Stenson duct is the duct of parotid gland. So, what is the function of this Stenson duct? It is responsible for draining the saliva from the parotid gland into the oral cavity. So, this one is the duct and this one is the parotid gland. So, where will this duct open? So, remember, very important question that can be asked by examiner in your entrance exam. Well, this duct it opens on the buccal mucosa opposite the second molar tooth. It opens on the buccal mucosa opposite the second molar teeth, and it will allow saliva to enter into the mouth. So, think you are enjoying a tasty piece of candy. So, your cheek, they have a special gland that makes your mouth watery by producing saliva. So, this saliva will help you to taste the candy better and make it easier to swallow. Stenson duct, it is a like small tube that starts in your cheek when the gland is where the gland is and goes into your mouth. So these small duct will carry the saliva from the cheek gland and release into your mouth. So Stenson duct makes sure that your mouth stays wet and comfortable while you eat your candy. So that is why answer is parotid gland. Stenson duct drains the parotid gland. Remember that for your entrance examination point of view. Moving to the next question, which muscles will make up the pterygomandibular raphe? Pterygomandibular raphe, it is made up of tendinous fibers. So this raphe would give So this raphe would give anterior attachment to fibers of the buccinator muscle, and posteriorly to fibers of superior constrictor, this muscle. So your answer is buccinator anteriorly and superior constrictor posteriorly. So imagine you are playing with a rubber band. So when you stretch it with your fingers, it become a tight connection. So tergomandibular raphe, it is like just like a rubber band, like a tough band of tissues inside your mouth. So that will connect your cheek to your jawbone, like just like a natural support system that helps to keep everything in your mouth in a right place. Remember this raphe is attached above to the pterygoid humulus and below the posterior end of mylohyoid line of the mandible. So your answer here is C. Mark answer of choice as C. So pterygomandibular raphe, it is a fibrous structure that is located in oral cavity, and it serves as attachment point for superior constrictor muscle of the pharynx. That's the muscle that plays a role in swallowing, and it attaches to the tergomandibular raphe posteriorly. The buccinator muscle, well, it is a thin flat muscle in the cheek that will play an important role like swallowing and speech. Moving to the next question, structure that are not passing through foramen ovales. The structure this pic is from your Gray's and from your BD Choracea. Structures that are not passing through foramen ovale, it's remember the mnemonic MALE, male. The structure passing are the mandibular nerve, accessory meningeal artery, L stands for lesser petrosal nerve, and E represents the missionary veins. So these are the structures that pass through these foramen ovale. Apart from that, you can see the structure that pass through the foramen spinosum. They are the middle meningeal artery, meningeal branch of mandibular nerve. So your answer here is the question is structure not passing through foramen ovale. Answer is B. It doesn't pass through the foramen ovale. Hope your answer is clear. The greater superficial petrosal nerve, it is a branch of facial nerve that carries parasympathetic fibers to the lacrimal gland, and it does not pass through the foramen ovale. Moving to the next question, which of following is not a part of ethmoid bone? The answer is inferior turbinate. Well, Agarnazi, it is a small bony ridge located in the upper part of the nasal cavity. It's part of ethmoid bone and it contributes to the nasal septum. The crista galli, this one is the crista galli. It is a bony ridge within the ethmoid bone that projects upward into the cranial cavity. It will serve as attachment for falx cerebri that separates the two cerebral hemispheres. Inferior turbinate, well, it's a separate bone within the nasal cavity. So answer is C. Uncinate process, it is a curved bony projection uh, on the lateral wall of nasal cavity. It's also a part of ethmoid bone and it contributes to structure of the nasal passage. The bones that are small, irregular shaped and found along the suture lines, they are known as Fomian bones. So these are the small irregular bones that are found along the suture lines. Which muscle originates from greater and lesser cornu and body of hyoid? So answer is hyoglossus muscle. So remember the origin. It originates from greater cornu and body of hyoid bone, and it is inserted into the tongue. The action of this muscle is to depress the tongue. Genioglossus, its origin is from genial tubercle or the medial surface of mandible. Inserted into the hyoid bone and tongue. Action is it protrudes the tongue and depresses the parts. Styloglossus, origin is stylo process of temporal bone. Insertion into tongue. Action is it retracts the tongue. So remember this table, very very important for your entrance exam point of view. What is the lower extent of the pharynx? Well, the answer is lower border of the cricoid cartilage. The cricoid cartilage, it is a ring-shaped cartilage located at the lower border of larynx, and it marks the lower extent of pharynx. So that is your correct answer. The posterior clinoid process is formed by dorsum sella. So this one is the dorsum sella and this is the posterior clinoid process. So dorsum sella, it is the posterior portion of the sella turcica, that is a saddle shaped depression in the sphenoid bone. The posterior clinoid process, well, it is the extension of the dorsum sella. So think of posterior clinoid process as a pair of little mountain peaks at back of your head, like tiny horns. Now remember the dorsum sella. It's having it's a ridge or a hill that connects these mountain peaks, like a top of bridge. So when you picture the posterior clinoid and dorsum sella, it's like having two small peaks and connecting the ridge at the back of your head, just like a mini mountain range. So these structures, they are part of sphenoid bone in your skull, and they help to support your brain just like a natural helmet. Which one is a paired venous sinuses? So remember the paired venous sinuses, they are the cavernous sinus, superior petrosal sinus, inferior petrosal sinus, transverse sinus, sigmoid sinus, sphenoparatile sinus, petrosquamous sinuses. So answer is all of them are paired sinuses. So the unpaired sinuses, they are the superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior intercavernous sinus, posterior intercavernous sinus, basilar venous plexus, all are the unpaired sinuses. Moving to the next question, the sternal angle, it is used in locating accurately the trachea. It develops it divides into right and left bronchi at the level of this sternal angle. So the sternal angle, it is located at the level of second rib. This second costal rib. The other name of sternal angle is the angle of Lewis. It is located at the level of second rib. So that is important for identifying, for counting the ribs and identifying the position of important structures in the chest. The nerve supply of the tip of nose. The tip of nose and lower part of dorsum of nose, they are supplied by external nasal branch of trigeminal nerve. So that provides the sensory innervation to this area of nose. The mandible fossa, it is a part of the glenoid fossa. It is a part of temporal bone. So it is a concave depressed area of the temporal bone. The mandibular condyle, it will rest in the glenoid fossa. A nervous dental student is performing local anesthesia for first time on one of his peers. He has read it notes meticulously and is very shaky. After inferior alveolar nerve injection, he gained confidence and performed the rest of injection without hitch. Next day, the classmate who performed the injection on is complaining of jaw pain and inability to open his mouth. So which muscle did the nervous student penetrate during inferior alveolar injection? Along with the masseter forms a sling around the mandible. The answer is medial pterygoid. So the muscle that the nervous dental student likely penetrated during the inferior alveolar nerve injection and that forms a sling around the mandible along with the masseter, it is indeed the medial pterygoid muscle. So this muscle, it plays a role in elevating the mandible during jaw closing. So the medial pterygoid muscle, we know that it arises from the medial surface of lateral pterygoid plate and it inserts on the medial surface of angle and ramus of mandible. The lymph nodes from the hard examination of a patient with ulcerative carcinoma of the posterior third of tongue revealed bleeding from lesion and difficult swelling. The bleeding was seen to be arterial. Which of following arteries was involved? Well, the answer is dorsal lingual artery. So the tongue, it is supplied by the dorsal lingual artery. The posterior third of the tongue, remember that. Which muscles causes retraction of the scapula? So remember the table, the answer here is rhomboides major. The muscle that causes elevation, depression, protraction, retraction. So remember all these muscles for your exam point of view. The esophagus crosses the diaphragm at level of vertebra. The answer is T10. So remember this. The trachea begins opposite to which vertebra? It's the C6 vertebra. So in this figure, you can see the angle of Lewis. Along with that, you can see the trachea and the main bronchi. So here the point that you have to note is the right main bronchus is shorter, wider and more vertical than the left. So this right main bronchus, it is shorter and this Left main bronchus is it is it is it is taller. That is why the inhaled foreign bodies most commonly enter the right main bronchus. Easy to enter as it is shorter and wider. The lymphatics from the hard palate and soft palate it drains to the retropharyngeal lymph node. So remember this. Here is the retropharyngeal lymph node. So it passes to the deep cervical lymph node to the retropharyngeal lymph nodes. So answer is C. Remember this table along with the lymph nodes from the submental area drain into the lower lip, chin, tip of tongue, anterior floor of mouth. And from the submandibular area, they drain into cheek, nose, upper lip, maxillary teeth, vestibular gingiva, anterior 2/3 of the tongue. And for the retropharyngeal lymph nodes, they drain into the nasal cavity, nasopharynx, soft palate, middle ear, external auditory meatus. So remember this for your exam point of view. The anterior superior part of the nasal septum it is supplied by the anterior ethmoid artery. Additionally, the superior labial branch of facial artery contributes to blood supply in this region. The posterior inferior part it is supplied by the sapheno-palatine artery. So answer is D, both A and B. This question we have discussed already. The movement at the following joint permits a patient to look towards right or left. It is atlantoaxial joint. The largest bone in the face it's the mandible. The fontanelle that is last to close is anterior fontanelle.